The World Health Organization says the coronavirus variant that's devastated India could threaten Southeast Asia countries. Hello, I'm Anand Naidu and this is The Heat. India is reeling from a new strain of COVID-19 that's fueled a surge of infections and death. To date, India has recorded more than 24 million cases and over 274,000 deaths. And experts say the numbers are likely much higher, with the virus now spreading to rural villages. Earlier, I spoke with the independent journalist Smita Sharma about the situation in New Delhi.
I would say it's a little better compared to, say, the past week or the past fortnight. We are being able to breathe a little more. I mean, I'm still waking up with a lot of SOS messages in my inbox. I'm going off to sleep after I've retweeted several calls for help. But the distinct sort of difference is now that perhaps a lot of this transmission is moving from the metropolis and from the national capital region, the bigger cities, to the smaller cities or the rural areas where people do not have the tech tools maybe to amplify their calls for desperation. But as far as the big cities are concerned, with the lockdown and with the government putting its house into slight order, things do seem to be recovering. For the moment, it's a sense of cautious optimism.
When you say you're getting SOS messages, what are people asking for?
You know, it's been a nightmare for the past many weeks now, because we would get distressed calls, people asking for drugs, the drugs that are being used to treat COVID, many of them without empirical data of its success, so remdesivir and ivermectin, people asking for plasma. A lot of people have been amplifying the messages of plasma donation, which is something that the Indian Council for Medical Research is now taking a relook at and perhaps taking it out of the protocol, because there's very little, in fact, empirical data, scientific data to point out to its success at this rate. People asking for oxygen supplies, oxygen cylinders, concentrators, ICU beds in hospitals. Those are the kind of SOS calls that we have all been flooded with at several levels for the past many days and weeks.
Now, the lockdown has been extended for another week. Are these lockdowns making a big difference?
They do seem to be making a significant difference, because I think we were at a point where all the infrastructure seemed to be completely collapsing. There was a lot of panic everywhere. If you look at, in fact, the national capital of Delhi, the positivity rate seems to have come down. But why I use the word seems is because we need to look at the data a bit more closely. So if you look at the number of tests that have been done, even the testing capacities have been reduced, or the number of tests have fallen. In Delhi, for instance, if I tell you about the past 24 hours alone, of the 53,756 tests, 11,907 were the rapid antigen tests, and these tests have been reported to be at least 50% faulty in several cases. So you do not know for sure that the data being reflected in terms of the testing capacity is solid here. Delhi has still reported 340 deaths in the past 24 hours, which is a high number. In Maharashtra, the western state, where in fact we saw that the mutant variant that we have been talking about, B1.167, which has triggered a lot of the cases in the rural areas and smaller cities. There the lockdown did seem to work, and the Maharashtra state health minister has pointed out that the active cases, which had reached close to 7 lakh in the state, are now somewhere close to 4.8 lakhs. So yes, in measured amounts, they are perhaps working essentially in trying to take the load off a lot of the frontline workers, essential workers, doctors, medical staff, hospitals that literally had gone breathless for the past couple of weeks now, since we saw the second wave peaking.
Now, what are you seeing at hospitals in the Delhi area? Because, for the past few weeks, we were seeing these pictures of people arriving in hospitals, literally pleading for beds, pleading for treatment. Has that eased in any way?
To some extent, yes. I think the queues of people waiting in ambulances outside hospitals, the queues of people actually having to manage their own oxygen cylinders, some even taking their own makeshift cots, waiting to be admitted inside hospitals, those have reduced. But then again, I need to remind, this is for the bigger cities. This is for the national capital area of Delhi and the surrounding areas that I'm talking about, because we have all been traumatized and scarred by those visuals. We've lost count of the number of family, friends, colleagues that we have lost. More than 150 journalists have lost their lives in the line of duty in the past few months itself. And we've seen people begging and pleading with hospital staff, administration staff, who themselves have been overworked and exhausted in COVID care centers, trying to find, one vacant bed for their loved ones. But it does look like in the past 3 to 4 days now, the situation is slightly better as far as these immediate bigger cities are concerned.
The Prime Minister of India, Narendra Modi, says the country is now on what he calls a war footing. Let's listen to some of what he had to say.
कोरोना की second wave से
We are removing all obstacles that are in the way of any resources we need in this fight against COVID-19. Work is being done on war footing. All departments of the government, all resources, our armed forces, our scientists, everyone is working day and night to counter the pandemic together.
So, Smita, when the Prime Minister talks about mobilizing all government resources, what does that mean?
Well, obviously, he is wanting us to believe that every part of the government, be it the federal government or the governments in the states, that they've been put into use, that the government is monitoring the situation 24/7, round the clock. Though that's something that is arguable, because there's a large section here that do believe that we have seen an abdication of governance and duties, especially by the government at the center. Because when you talk about a pandemic, health remains a state subject under the Constitution of India. The states, the provincial assemblies are allowed to actually frame laws on it. But when you have a pandemic, then it's really the Epidemic Act, the Pandemic Act that sets into place. And it's the center, the Union Cabinet led by the Prime Minister, that becomes the driving force. So yes, they have definitely woken up to the dangerous consequences that we have seen through the second wave. But there's still a lot that needs to be done.
Now, what about aid from the international community? China has shipped ventilators and oxygen generators to India. The United States has also donated $100 million in supplies. There have been several planes with supplies landing in India. How much of a difference is that making?
Look, there's a lot of foreign supplies aid that has definitely come in, and it's also marked a shift in India's own foreign policy, which has opened up to allowing such aid to come in times of this national health emergency after almost a gap of 16 years. It's a pandemic of epic proportions, one that the country obviously hasn't seen in decades. But as of 16th of May, if you see the list that was put out by the Union Health Ministry here, India has received more than 11,000 oxygen concentrators, more than 13,000 oxygen cylinders, some 19 oxygen generation plants, which are major big ones, including from Germany and France, that have already been put to use in some of the bigger central government controlled hospitals. Also almost 5 lakh and above remdesivir vials. So these have all been received as global aid. Many of these have been sent out to the states and union territories. But what I have written about in the past, including several other voices in media here, we pointed to the fact that a lot of crucial time was lost in the first 5-6 days, almost around from 26th, 27th of April, when these foreign supplies started coming in, because a lot of these aid materials were lying, waiting for custom clearances. They were waiting at the airport warehouses. The standard operating procedures or the SOPs had not been put in place. The nodal agencies in the states and the smaller districts hadn't been discussed. And in that time period itself, we lost some 20,000 additional lives, which is huge.
What about the vaccination program in India? India is a country, of course, that manufactures vaccines. It's the world's biggest manufacturer of vaccines, but has only inoculated about 3% of its population, just under 3%, 2.9%. Is there any kind of a program in place right now? Has the government done anything about getting vaccines to more people?
Of course, there's a program, there is a plan in place and the government is working towards it. Look, it's a huge country. It's a country of 1.3 billion. When we talk about numbers in India, nothing is, it is actually, you can compare it to several countries combined together. So if I could just share some numbers with your viewers, as of 17th of May morning, the cumulative vaccination coverage exceeded more than 118 million. This does include the first dose that has been administered to almost 140 million and a second dose to more than 40 million. So more than 5.2 million vaccine doses have been administered in the age group of 18 to 44 years because the vaccinations opened up in phases here. It was first for the frontline workers, senior citizens, elderly with comorbidities. Then it opened up to people above 45 years of age. And currently it's being rolled out, albeit in a very slow fashion, for people above 18 years of age.
Smita, thanks for joining us.
Thank you so much.
Well, for more now on the variant identified in India and the threat it poses to Southeast Asia, let's bring in our panel. Joining us from the Republic of Korea is Dr. Jerome Kim. He's a specialist in HIV vaccine research and the Director General of the International Vaccine Institute. Also with us from Malaysia is Dr. Abhishek Rimal. He's the Asia Pacific Emergency Health Coordinator with the International Federation of Red Cross and Red Crescent Societies. And from California, Dr. Lee Riley is a professor and chair of the Division of Infectious Disease and Vaccinology at the University of California, Berkeley. Thank you to all of you for joining us. Before we get to COVID in other parts of the world, as well as in the United States, Dr. Lee Riley, I want to ask you about the situation in India, because you've lived there, you've worked there. What do you make of what's going on there? I mean, as we just heard, it's a country of 1.3 billion people. What's it going to take for India to turn the corner?
Well, it's a huge tragedy that we're witnessing. And the unfortunate part of this whole thing is that India was doing very well until just last month. India served as a kind of an example of a country where lockdowns were really shown to be effective. But unfortunately, they relaxed these restrictions, and we're now witnessing the impact of those decisions that were made. And so it appears, though, that this trend appears to be flattening, maybe, but the caveat there is that, yes, the number of cases appear to be decreasing in the large cities, but they are increasing in the rural areas. And when these diseases occur in these rural areas, they don't necessarily get reported. Mm-hmm. And so I'm not sure if we're really getting the true estimate of the magnitude of the problem. Yeah. The unfortunate thing is that it appears to be shifting now towards rural areas, so it's going to be not as visible.
Right, just as we heard from our correspondent or the guest, our previous guest there could be serious undercounting. Dr. Abhishek Rimal, the World Health Organization recently classified that coronavirus variant that's in India as being, and I'm quoting here, as a variant of global concern. It's already spread to more than 30 countries. How concerned are you that Malaysia could also see this variant?
So at this point of time, the B1617 variant that has been spread to more than 30 countries, which was first seen in India and is also responsible for the higher transmissibility and has also a property of escaping the neutralizing antibody at this point of time, is a matter of great concern. At this point of time, several Southeast Asia countries are receiving few cases of this variant. And in Malaysia, at this point of time, we have just one case of this variant. And government had been successful in keeping this variant out of this country. But in due course of time, if this variant reaches the country has to be more cautious in scaling up its public health measure so that we prevent it from getting into the community and the community transmission can be stopped.
Dr. Jerome Kim, Southeast Asia managed to combat the virus in 2020. It did a very good job on that, but now we're seeing this new surge. What's behind this new increase in numbers?
Well, when you look at the total increases compared to some of the other countries around the world, the increases are not that big, but they do reflect a significant change from the baseline. I think that the Southeast Asian countries are concerned because the ability to continue with restrictions or decreased travel has had a definite impact on economies. I mean, when you look at, for instance, Taiwan, which had done a remarkable job at controlling the outbreaks early on, they are seeing an increase in the number of cases. When you look at Singapore, you see the same thing. The governments are responding appropriately and quickly to try to rapidly control the outbreaks and resume life as it was before the outbreak started. In several of these countries, the ability of the governments to rapidly identify, test, and isolate people who are infected were a key part of control. And hopefully those techniques will continue to work.
And the increase itself, is it because people are beginning to travel again? Is it because certain sectors of the economy in these countries are reopening?
So, and this is an interesting thing. Despite the precautions that were put into place, there are cases that appear without a clear cause, for instance, in Korea.
Yeah.
And the government is trying to identify them at the same time as it's trying to mount a very effective response and to try to control outbreaks as they occur. So it's going to be difficult because I think people are getting tired 18 months into the pandemic. The ability, ostensibly, if you go out on the street, for instance, in South Korea, people are wearing masks. But we're seeing 600 to 700 cases a day in a country of 51 million people. But that means that at some point the masks are off and people are being exposed to other people who are COVID-19 infected. So again, these restrictions are fine, but in the end, a systematic approach to prevention will have to include the vaccination of the population.
Dr. Lee Riley, as I said earlier on, the WHO has classified this COVID variant in India as a, quote, variant of global concern. But what does that mean? Why global concern? And what is the particular characteristics of this particular mutant that we should be aware of?
Right. So this is one of several so-called variants of concern that we've seen emerge in different parts of the world. And one, I guess, categorization for considering a virus to be a variant of concern is its increased transmissibility and then spread to multiple regions of the world. And so we now know that this particular variant has spread to local neighboring countries, and it appears to be more transmissible. It's not clear if it's any more virulent than the other viruses, but the good news is that it appears to be still susceptible to the currently used vaccines, at least the vaccines that are used in the United States.
Dr. Abhishek Rimal, as of this past Sunday, if we look at Malaysia again, Malaysia had 470,000 recorded cases of COVID, and just over 1,900 people have died. That's the third highest infection rate in the region, behind Indonesia and the Philippines. What's behind these numbers in Malaysia, and how is the Malaysian government responding?
Yeah, the cases have definitely surged in Malaysia in past couple of months. Maybe the couple of reasons because for this surge can be one is the presence of variants of concern B117 as well as B1617 in the country, and then the B1351, which was first detected in South Africa. These variants have higher transmissibility than the original strain. At some point of time, like we are now more than 1 year into the pandemic, people are also a bit sick and tired of the regulation and the basic public health measures that have been placed in since the beginning of the pandemic. And there were instances across the country that people have let down their guards, and that have given a fertile land for this virus to just flare up. At the same time, the government in Malaysia has been repeatedly requesting the public to maintain the standard operating procedure, the basic public health measure, and trying to redouble its effort in really giving the health awareness messages with the Red Cross, with other organizations to the people, try to increase its capacity on the healthcare, increase its testing capacity, testing each and every construction worker in the country so that we can appropriately test, trace, and treat all the COVID-19 cases. At this point of time, Malaysia is in a movement control order for 1 month, so the travel is also restricted, and we do hope the cases will slowly start coming down in Malaysia in the near future.
Dr. Riley, I'd like your thoughts very briefly on what we've been hearing here, and that is we see that in countries where people have let their guard down, numbers have gone up, and as we are fully aware in the United States, there's quite a big debate going on at the moment over the mask mandates, which were initially lifted for people outside and then has just been lifted for people inside. Is there a lesson for the United States from what has happened in other countries?
Of course. I guess one difference is that compared to the countries that we have been talking about, we have a higher rate of vaccination. And so this is one of the reasons that the CDC recently came up with a new guidelines for wearing masks, that they no longer require masks outdoors and in certain indoor facilities. Yeah. But without the vaccine, without a large proportion of the population being vaccinated, this kind of guideline will not work.
Dr. Jerome Kim, the WHO Director General, has been addressing the question of vaccine inequality and distortions in the availability of vaccines around the world. Let's listen to what he had to say.
The shocking global disparity in access to vaccines remains one of the biggest risks to ending the pandemic. High and upper middle income countries represent 53% of the world's population, but have received 83% of the world's vaccines. By contrast, low and lower middle income countries account for 47% of the world's population, but have received just 17% of the world's vaccines.
So, Dr. Kim, given those figures we just heard there, how is this impacting middle and low-income countries?
So that's a great question, and it actually involves all of us because, as you know, all of us everyone in the world is potentially impacted by COVID-19. The first part is there's been a lot of modeling around what would happen if the high-income countries used pretty exclusively the first 2 billion doses, which is a situation pretty close to what we're seeing now. And in that scenario, global COVID deaths could be seen to double. So if you think that there are about 3.4 million deaths, think about 6.8 million deaths from COVID-19 as a result of the absence of equity. The second argument is economic. I think high-income countries have felt that vaccinating their own populations pretty quickly was going to help them to recover economically more quickly. Again, modeling from the National Board of Economic Review, from the Brookings Institute, and now from the U.S. Office of National Intelligence are telling us that in order for that the cost of COVID in 2021 will be $4 to $5 trillion borne primarily by high-income countries if there isn't more equity in vaccine distribution. The final problem is a biological consequence. We know that these variants are being generated in uncontrolled epidemics. And I think you heard the case from India. It's one thing to be going on in a city, in an Indian city with a lot of technology. It's a lot different when infections are occurring in the countryside where they don't have the ability to track things. So think about the rural parts of India, but also think about those parts of the world, for instance, in sub-Saharan Africa, where we don't necessarily have the ability to test or to identify variants. Right. So the biological crisis that could be brought on by the lack of containment and the lack of equity is another thing that could undermine $20 billion worth of investment in COVID vaccines.
Dr. Riley, here in the United States, President Joe Biden on Monday afternoon announced that the U.S. will take steps, he said, to slow the spread of COVID internationally. Let's listen to part of what he had to say.
By the end of June, when we will have taken delivery of enough of such vaccines to protect everyone in the United States will share at least 20 million of those doses, that extra supply, with other countries. This means over the next 6 weeks, the United States of America will send 80 million doses overseas. That represents 13% of the vaccines produced by the United States by the end of June.
So, Dr. Riley, what impact will that have?
Well, it will have some impact, but just looking at the population of India, it's 1.3 billion people. Yeah. That's going to be a small percentage of just in India alone who could potentially be vaccinated. And so it's not just the U.S., but all the vaccine manufacturing countries should be participating in this, and they are. There is this international organization called COVAX, where they're accumulating vaccines from all the manufacturing sources from the Western countries, and then making them available to the resource-limited countries in the world. So we need to do a lot more than just 80 million doses.
Dr. Abhishek Rimal, in Malaysia, the country's health director general has warned that Malaysia is actually running out of hospital beds. He said that ICU units, ICU occupancy is running at about 80% right now. What can you tell us about the hospital situation there?
Yeah, when the cases start surging in Malaysia, the hospitals start getting quickly filled. The government have put now the measures to expand the hospital beds in different parts of the country to ensure if there is a major surge, so that the people can get the access to the necessary hospital facility. On top of that, at this point of time, since the Malaysia has now gone on to lockdown, we have seen slight decrease in cases, and also the recovery rate has increased in the country from then. Hence, at this point of time, the hospital seems fine, and with the efforts of the government of increasing hospital beds, the Ministry of Health is quite confident it can handle a certain amount of surge. But if Malaysia sees something close what we have seen in India or Nepal, it will be difficult for any country for that matter to handle that with the capacity they have at the hospital. And only way to prevent such thing is to ensure public health measures are followed by every individuals in the country.
Dr. Jerome Kim, very quickly, I've only got about 30 seconds. So what efforts are being made in South Korea to increase the number of people who have been vaccinated? At the moment, the figure is 7% in a population of 52 million people.
Well, so the government of Korea has purchased enough vaccine to vaccinate 90 million people. They're just waiting for the shipments. And for instance, like India, the process of getting into the queue for production was somewhat delayed. At the same time, Korea is a manufacturer of vaccines. So Korean companies have made deals with AstraZeneca, Novavax, and potentially others like RNA vaccine company Moderna to actually manufacture vaccines in Korea.
Okay. Okay, that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.